Hello everyone, welcome back to Sowkya Med Vision. This is a part 2 of breast. As it is a big topic, we have divided it into two parts. Part 1 is has already dealt and this is part 2. And in the last class, we have completed the morphology of breast, the shape, structure and parenchyma, stroma, skin, nipple, areola. In this lecture, we are going to cover the drainage part, arterial supply, venous drainage and very importantly, lymphatic drainage. See, breast is a very important topic, very important topic. Put 3 stars for this topic. It will be very important topic in the academic wise as well as in the competitive exam. Yes, today we are going to discuss the arterial supply, venous drainage and very importantly, lymphatic drainage of the breast. Yes, the arterial supply. Breast is a very vascular structure. Yes, it is very vascular structure. The artery supply from internal thoracic artery, lateral thoracic artery, superior thoracic artery, posterior intercostal arteries, pectoral branch of thoracoacromial artery. First of all, you remember these 3. Internal thoracic, lateral thoracic, superior thoracic and then pectoral branch of thoracoacromial artery and posterior intercostal artery. And the venous drainage, which is by 2, superficial and deep. These veins get divided into superficial and deep and drain the breast. Axillary vein, internal thoracic vein, posterior intercostal vein. Yes, let's see the lymphatic drainage. It is a very important topic. It can be included in the long question as complete morphology and the drainage part of breast, or also it can be asked for separate short answer. Yes. And let's see what are the lymph nodes draining the breast. The axillary group of lymph nodes. Axillary group of lymph nodes containing 4 anterior lymph nodes, posterior, central and lateral, and internal mammary gland lymph nodes. Yes, along internal thoracic vessel. It is presented along internal thoracic vessel. And supraclavicular lymph nodes. Supraclavicular means what? Above the clavicle. So these nodes are presented above the clavicle. And posterior intercostal nodes presented posteriorly. Yes, now the last one are cephalic, presented at the top, or deltopectoral nodes. At deltopectoral groove. These are presented at deltopectoral groove. Yes. Now let's see the drainage part. First of all, we have to divide complete breast into 4 parts, into 4 quadrants. Yes. See, if this is the breast, we have to divide this breast into 4 parts. This will be the lateral. This will be the lateral and this will be the medial, right? This is the right breast. So here will be the arm, here will be the sternum. So this is the medial part, medial quadrants. These are the lateral quadrants. These are upper quadrants, right? So upper lateral quadrant, upper medial quadrant, lower lateral quadrant, lower medial quadrant. So divide the breast into 4 parts and then drainage will be easy. See, as I said, drainage by 2, superficial and deep. Superficial draining from skin except areola and the nipple. Yes, and the deep is draining parenchyma and skin, nipple, areola. Yes, skin of nipple and areola. So let's see the lateral quadrant. The lateral quadrant of the breast. See, this is a lateral quadrant of the breast. Is drained into anterior axillary group of lymph nodes. See, this is the anterior axillary group of lymph nodes, right? So the lateral quadrants are drained into anterior group of lymph nodes, anterior axillary part of lymph nodes. And now medial quadrants. These are the medial quadrants, right? So medial quadrants are drained into internal mammary lymph nodes. Yes. Now the lower lateral quadrant. This is the lower. This is the lateral. Is drained into posterior intercostal lymph nodes. So the lower lateral is drained into posterior intercostal lymph nodes. And lower medial quadrants. See, this is the lower and this is the medial, right? So this lower medial quadrant is drained into subperitoneal lymph nodes. Yes, subperitoneal lymph nodes. And the deep surface of the breast is drained into apical group of axillary lymph nodes. Yes, here it is the apical group of axillary lymph nodes. So the deep surface of the breast is drained into apical group of axillary lymph nodes. Yes, let's see the clinical correlation of the breast. Very important. If any question asked on either short answer or the long answer, you have to must attempt to write clinical correlation of the breast. Yes, let's see. First one is POD orange appearance. It is the appearance of breast like a peel of orange. Like peel of orange. Why? It is due to obstruction of superficial lymphatics. Obstruction of superficial lymphatics leads to orange peel-like appearance of the breast. Next, Krukensberg tumor. As I said, the lower medial quadrant of the breast is drained into subperitoneal lymph node. So, lymph plexus. So, any cancerous condition in the breast is easily passed through subperitoneal lymph plexus and they reach ovary. Yes, they reach ovary. The cancer cells from the breast is reaching ovary through lymphatic drainage. That condition is known as Krukensberg's tumor. Yes, next, radial mastectomy. It is complete. Whole breast is removed with axillary lymph nodes. Yes, now the breast cancer. You have to definitely write these 4 clinical correlation in any questions related to breast. Yes, carcinoma of the breast. It is mainly in the female. Yes, very profound in the female. It is from epithelial cells of the lactiferous duct. Yes, it is due to epithelial cells of the lactiferous duct. It is mainly occurred at the age of 40 to 60 years of age. Cancer of breast occurs at the age of 40 to 60 years of the age. So, what are the symptoms? The symptoms are painless hard lump. Hard lump is present, like a strom is present, which is painless. Yes, like a tumor structure is present, which is painless. And breast is very tough and fixed and immobile. It cannot be movable. Yes, and retraction of the nipple. Nipple is conically protruded out. So, in the cancerous condition, the nipple is retracted inwards. So, why all these conditions are occurring? It is due to obstruction or infiltration of suspensory ligaments. Yes, the suspensory ligaments are infiltrated. Hence, these conditions are occurred. Yes, this is the clinical correlation and the drainage part of the lymphatics. This is the complete discussion of breast. If you have any doubt, please comment in the comment section. If you like the video, please do like, share and subscribe the channel. Thank you.